Subsequent pregnancies are discouraged in patients who have reduced left ventricular ejection fraction after an episode of peripartum cardiomyopathy as per recommendations, though it may sometimes be considered in those who have fully recovered. A retrospective review from the US checked 137 patients with peripartum cardiomyopathy in a registry. Of these, 45 patients with subsequent pregnancies with a mean age of 27 years were included in a study. 80% of the women were of African American descent and 75.6% were from low socioeconomic background. Two-thirds of them had recovered from the initial episode as defined by a left ventricular ejection fraction 50% or more. 40% of patients had 2 or more subsequent pregnancies. 3 or more subsequent pregnancies were noted in 6.7% of those who had not recovered and 26.7% of those who had recovered. Subsequent pregnancy was associated with mean decrease in LVEF from 45% to 41%. P is equal to 0.009. Adverse outcomes at 5 years were significantly higher in those who had not recovered compared to those who had recovered LVEF, 53.3% versus 20%, driven by a relapse of peripartum cardiomyopathy. 5-year all-cause mortality was 13.33% in those who had not recovered LVEF, while it was 3.3% in those who had recovered. At a median follow-up of 8 years, adverse outcomes and all-cause mortality were similar in both groups, 53.3% versus 33.3%, P is equal to 0.20, and 20% versus 20%. Authors concluded that subsequent pregnancies in women with peripartum cardiomyopathy were associated with adverse events. Normalization of LVEF does not guarantee a favorable outcome in subsequent pregnancies. An accompanying editorial highlighted the 20% mortality in both those who have recovered and in those who have not recovered initially at 8 years. An important limitation regarding generalization of the results was also pointed out. This study was from a single center where mortality in women with peripartum cardiomyopathy was higher than in other studies from the United States. Most of the patients were African American and of low socioeconomic status. Earlier studies have clearly demonstrated a different phenotypic presentation and outcome in African American women with peripartum cardiomyopathy compared to non-African American women. African American women had been shown to be diagnosed later, present lower LVEF, larger LV volume, and more severe heart failure symptoms. The rate of recovery was lower and time for recovery markedly longer in that patient group.